Thank you very much, Minister. Please, let's take our seats once more. Madam Chancellor, distinguished participants, ladies and gentlemen, I am pleased to preside over this yet another key moment in our country's journey to strengthen education, expand opportunity, and build a healthier and more resilient nation. We gather to honor AMREF International University, an institution that has earned its place as a leader in health sciences in this continent. This charter is not a symbolic gesture. It is a recognition of excellence, integrity, and demonstrated impact. It is an acknowledgement that when institutions align purpose with action, they transform societies. One of the most remarkable things about AMREF International University is that its story did not begin in lecture halls or boardrooms. It began in villages, clinics, and communities across Africa. Before there were classrooms, there were outreach teams. Before there were degree programs, there were health workers trained to serve where the need was greatest. Before titles and credentials, there was trust, earned through service, compassion, and results. That is why today's honor carries from the ground up or from the bottom up, anchored in real human need. This university stands as a powerful example of Africa's capacity to produce knowledge, craft solutions, and shape its own future. Since its establishment in 2017, it has grown from the strong foundation of AMREF Health Africa, an organization with nearly 7 decades of service to community health in more than 30 countries. What began as AMREF International Training Center has evolved into a premier Pan-African university dedicated to training health professionals who lead with innovation, empathy, and integrity. The university's progress speaks for itself. From just 246 students in 2018, AMREF International University now serves more than 3,800 learners from 32 countries across Africa. 70% of the students, I am informed, are women, an inspiring indicator of its commitment to advancing women's leadership in health. And it is no chance that the Chancellor is also a great lady. Some 13% of the students currently benefit from scholarships, helping to expand inclusive and equitable access to education. Since 2018, the institution has graduated 1,665 professionals who are now serving communities across the continent, strengthening health systems, advancing primary health care, and saving lives. Ladies and gentlemen, this institution is demonstrating what an African university can be when it embraces innovation and stays close to the realities of the people it serves. Through open and distance e-learning, the research and community extension programs, the Health Entrepreneurship Academy, and the Center of Excellence for Primary Health Care, the university is not only educating students, but also shaping problem solvers, entrepreneurs, and leaders. This is precisely the kind of transformation needed in our continent. As AMREF International University receives its charter, we recognize not only an institution, but also a philosophy that Africa's challenges can be solved by African institutions. African ideas and African leadership can contribute meaningfully to solutions for our region. To the founders and early champions of this university, you dared to imagine that a continent could build its own centers of medical excellence. You refused to wait for solutions from elsewhere. You built them here at home, and we applaud your courage, your vision, and your relentless service to humanity. I must commend Githinji for the comments that he has made, especially the dedication of AMREF University to training health professionals. It is a space that speaks to the needs of the present and speaks loudly to the needs of the future. As I speak to you, 3 years ago, we converted community health volunteers, people who went out of their way as volunteers to serve communities in different aspects. We converted them to community health promoters. We now have close to 110,000 community health promoters across Kenya. We pay them now a stipend. We have given them very basic training. We have equipped them with gadgets and equipment that they can use in our communities. Proudly this morning, I was being given the statistics that they have visited 8 million people in Kenya, referred close to 500,000 to hospitals. I am asking AMREF, because your strength is in working with communities and the space around health workers. We will be working with you, and I will get the Ministry of Health to work with you to see how we can enhance the capacity through training of our community health promoters so that they can do more to our health space. I know, Gitahi, you have said that you've trained 10,000. I want to tell you I have another 110,000 which you can train. And it is a very primary aspect of health. As we all know, as the people of Kenya, we have been focused, and we have made, I think, 3 or 4 attempts at universal health coverage. But this time round, we decided that failure is not an option. And that is why we have rolled out universal health coverage. We've changed the legal foundation. We now have 4 pieces of legislation. We have come with the primary health fund, and I want to commend AMREF because they worked with us on the setup of primary PCNs, primary care networks around the country. We now have 315. We have clustered communities and health facilities so that it becomes easier for us to manage. And we couldn't have done it without the support of AMREF. They not only gave us support in terms of the human capital and the training that was necessary, they even gave us sponsorship. So on behalf of the government of Kenya, I want to say to AMREF, we sincerely thank you for your partnership in delivering the most critical aspect beyond education, health. And it was a commitment I made that having sorted out to a good extent matters education, the thing that required our attention was health. And I'm very happy that today we're not only working on the human capital aspects, we have also figured out funding, and we have mobilized domestic resources, actually doubled domestic resources that we have mobilized for matters to do with health. We have rolled out an innovative program that will equip most of our health facilities. I know, Dr. Gitahi, you have said that you are building a level 6 hospital here. When the time comes for equipping that hospital, I have some ideas. I have some ideas. So if you pay a visit to me, I will tell you how to equip that hospital. It is the same innovative mechanism that today we are equipping hospitals across Kenya under a fee-for-service arrangement that doesn't give you a huge financial outlay for you to have the equipment. And I am looking forward to working with you as we expand the footprint of health infrastructure in Kenya, because health is a constitutional requirement. Section 43 of the Constitution demands of government to provide every citizen to the highest standards of health. And I did commit that health is no longer going to be a privilege for those who have the means, who have jobs, or who have the wherewithal. It's going to be a right of every citizen. And I'm very proud that we are walking that journey, and AMREF has been a great partner as we move in that direction. Kenya's private universities play a central role in shaping our human capital. Of the 82 chartered universities in the country, 37 are private, and today AMREF International University become the 39th university after Monday's 38th university. Private universities account for more than 20% of all university enrollment and are essential partners in expanding access to quality higher education. They innovate faster, adapt more quickly to industry needs, and stand ready to respond when the country faces shortage in critical skills. When Kenya needed more health workers, institutions like this one stepped forward. This is what it means to build a nation that works for its people. Africa carries 25% of the global disease burden, but has only 3% of the world's health workers. Kenya currently has about 189,000 registered health workers. But to achieve global standards and for our universal health coverage plan, we need at least 300,000 more in the coming decade. And AMREF International University is going to be a central cog in making sure that we have these personnel. This is why your work is not ordinary. It is strategic. It is national in importance and continental in relevance. Our education system must produce graduates who can solve real problems. That is why we are reforming learning from early childhood to the university. Our competence-based education and training system is being strengthened to ensure learners acquire practical and relevant skills. At the technical and vocational level, more than 2,000 institutions are now training over 700,000 young people for industry. In our universities, enrollment currently stands at 650,000 students. Through the new higher education funding model, students receive government support based on their levels of financial need. And for the first time, scholarships, loans, and bursaries are being distributed fairly and transparently. To expand access further, we established the Open University of Kenya, ensuring that quality education becomes available to every Kenyan who needs it, anywhere, every time. We are also strengthening funding for science and innovation. The new Kenya National Research Fund framework prioritizes research in health, agriculture, manufacturing, and climate change. And universities that align their research with national priorities will receive support to scale up their impact. That information is very relevant to the Vice Chancellor. If you speak to Professor Shaukat, who I appointed Principal Secretary for Research, I did establish a standalone state department because research continuously is becoming essential and central to any meaningful progress in a nation. And therefore, we have consolidated all our research resources, funding and strategy in one state department. If you engage him, we are looking at priority areas that will spur greater impact in areas that are important to the nation. Ladies and gentlemen, Kenya's future depends on the well-being of its people. Our healthcare reforms, including the Social Health Insurance Act, the Digital Health Act, the Primary Health Care Act, aim to ensure every Kenyan receives quality and affordable care. But policies alone cannot treat patients. Health workers, institutions like this are therefore essential to the success of our reforms. As you enter this new era, under your charter, I challenge AMREF International University to do three things. Number one, expand access by partnering with county governments to train health workers closer to the communities that need them the most. And in this particular aspect, I am talking about, we have so many community health workers. We have so many other health workers that do not have the level of training and the level of education that would make them efficient and much more effective. Second, accelerate research with purpose. I have told you, Vice Chancellor, where you're going to get the money. Kenya needs evidence that reduces maternal deaths, strengthens primary care, and combats emerging diseases, not academic papers that sit untouched on shelves. Vice Chancellor, I hope you are taking notes. Third, invest in ethical leadership. The health sector runs on trust, and it is therefore imperative to train professionals who uphold the highest standards of service, honesty, integrity, and respect for life. To the faculty and leadership, this achievement is very well earned. To the students, this charter is not just an honor. It is an invitation to rise to greater responsibility. To our partners, thank you for standing with AMREF on this journey, the Kenyatta family, and all the other benefactors. And to the Commission for University Education, continue safeguarding quality without compromise. And I have listened to you very well, Mr. Chairman, and I am going to provide the necessary approvals for you to hire adequate staff so that you can discharge the responsibility mandated of the community university, of the Commission for University Education as appropriately as is required. And Minister Migosi already, I think, has already done what is necessary. If it is not enough, please let me know so that we can facilitate your work. Today, we welcome AMREF International University fully into Kenya's family of chartered universities. May this institution continue to inspire knowledge, service, and hope for our country and our continent. Congratulations, my very best wishes, and God bless you.